Welcome to Sisters Inc., our podcast for and about women business owners, brought to you by Black Enterprise. I'm your host, Elisa Gumbs. Black women are the fastest growing group of entrepreneurs in America. And on every episode of Sisters Inc., we'll sit down with one successful CEO and share how she slays the challenges of being a Black woman in business. Today's episode is all about prioritizing our health. We're chatting with Linda Goler-Blount, President and CEO of Black Women's Health Imperative, the only national organization dedicated to the health and well-being of Black women and girls. Welcome to Sisters Inc., Linda, and thanks so much for sitting down with us.
Thank you so much for having me, Elisa. I really appreciate it. It's good to be here.
Tell us about Black Women's Health Imperative and the work that the organization does.
Okay. Well, the Black Women's Health Imperative is actually the only national organization focused solely on the health and wellness of Black women and girls, and we have been for more than 38 years. More than 38 years ago, Billie Avery brought 2,000 of her closest friends together to Spelman's campus to talk about how we should take care of each other, but most importantly, take care of ourselves, to practice self-care. So for these 38 years, we've been steeply rooted in practicing self-care and what that means for chronic disease prevention and risk reduction, what it means for HIV prevention, our sexual health, reproductive justice, really understanding that we deserve to be healthy, and what structural barriers mean. So we have a strong policy department that's working both at the national and state level to eliminate those barriers to access to care. And in the last 8 years, almost 8 years or so that I've been on board, what I've brought is an emphasis on research. I think I'm the first scientist to be in this role because we've got to look at what research means for our health, whether or not we participate in it, what evidence means, what evidence doesn't mean. And we saw last year what happens when you leave an entire population out of the scientific process. We saw that the pulse oximeters didn't work as well on COVID-19 patients who had dark skin, or that dexamethasone wasn't as effective on African Americans. So it is critically important that we participate in science, but that science is led by people like us. And the most recent initiative that sort of came out of all of this that I'm really excited about is looking at the effect of racism on our health, looking at the impact of gender discrimination on our health. We've got 30 years of research and data that really no one has done anything with. And so I'm really excited that the Black Women's Health Imperative has launched the first ever workplace anti-racism initiative to help corporate leaders understand this impact, but really importantly, to help Black women understand and navigate and practice self-care so that we can reduce the impact of racism and gender discrimination on our health.
So you mentioned your focus on research. Can you tell us specifically about the work you do with the organization as its CEO?
I can. I am an epidemiologist. And so a couple of years ago, no one thought much about epidemiology, and suddenly it's a word on everybody's lips, it seems. But from a research perspective, I'm looking particularly at clinical trials participation and how they're designed, how they're conducted, how we recruit Black women in particular in clinical research, how we treat them once they're participating in clinical research. We know, for example, that the number one reason Black women don't participate in clinical research is that no one asks them. Doctors make a number of assumptions about what we will and will not do. And so we get left out of this process. And also we've got to change the pipeline. Less than 2% of NIH funded researchers at the highest level are Black. And frankly, the percentage of Black physicians hasn't changed in 40 years. So I'm looking at clinical trials participation. I'm also looking at breast cancer and cervical cancer research. We've just launched a huge project called Project Health Equality that's going to look at the experience of Black women from the moment they walk in the office all the way through their last treatment for breast cancer, for cervical cancer, and for uterine fibroids, so that we can learn more about effective therapeutics, but also about the changes in systems of care delivery that need to take place to improve our health outcomes.
Most of us, I think, understand instinctively that there are health disparities in our communities, but can you shed some light for us about the health gap for Black women specifically?
Yeah. We spend, in public health, we spend a lot of time talking about health disparities and these differences in health outcomes that Black women and women of color experience. And part of the challenge is, I think, in the way we use the language, because sometimes I think we inadvertently lead people to believe, oh, it must be because they're Black. We talk about the mortality gap in breast cancer. Black women die 42% more than white women from breast cancer. It's not because we're Black. There's no biologic or genetic determinant to that. It has to do with access. If you go back to 1982, the mortality rates for breast cancer between Black and women were identical. Then in 1983, they began to change, and we see this 40 to 42% gap now. Well, that gap only reflects who got access to early screening and detection and effective treatment and who didn't. And you see that with cervical cancer, you see that with diabetes and heart disease, you see that with any number of conditions, that it really is an issue of access, where treatment is located, whether or not we are offered aggressive treatment, how we're treated by our providers, and of course, what even happens in the therapeutic development process. So while there are disparities and these differences, they're not because we're Black. The only, there are few issues where this is an issue, and this is with something like sickle cell, which again is not because we're Black, it's from its country of origin. It's what part of the world this particular trait was prominent in. And so what we're trying to focus on at the Black Women's Health Imperative is to help Black women understand that, but really importantly, help providers, help healthcare leaders, hospital systems understand how Black women and women of color need to be treated so that we can get the best outcomes. Instead of treating us differently because we're Black, they need to treat us in the way that makes sense because of our lived experiences.
You told us earlier that Black Women's Health Imperative has developed a new workplace equity initiative to measure the progress of corporations who say they want to improve diversity, equity, and inclusion. And I think that it's really groundbreaking because no one else is out there tying those two things together. So, can you explain for our audience what the connection is between what happens in the workplace and Black women's health?
For a lot of us, we spend a good 30% of the week. Some of us spend even more than that in the workplace, whether we're on site or working remotely, like I am, perhaps even like you are, we're working. And so there's a couple things that I think are really important. Most Black women and women of color have experienced what we call microaggressions, which never, ever feel micro when we're experiencing them. From the, why are you so dressed up today in the office, to why are you wearing your hair like that, to why have you changed your hairstyle? I mean, we get all kinds of comments and questions that have nothing to do with our work performance. But the other thing is, from the research, we know that Black women in particular work on average about 20% more than white women. And we do that because we think we have to. We check, we double check, we triple check our work. Because as a friend of mine said, no can come from any place, any level in the organization. So we always have to be on high alert that somebody is going to find something about our work and say something, that we have to prove that we are qualified. The fact is, our work is fine, usually. But this double and triple checking, this working an additional 20% takes its toll on our health. And what the research has found is that even though we work 20% more, there's no greater benefit to the company, earnings per share, productivity, revenue, cost savings. There's no business metric that improves because we work 20% more. The one thing that happens is it takes its toll on our health. So we see higher rates of diabetes, of heart disease, of certain cancers. What we know is that Black women have on average about 15% more cortisol, which is a stress hormone, in our bloodstreams at any point in time. And so all of this excess work, all of this response to the racism, the gender discrimination, these micro and macro aggressions takes its toll on our health. And so what we wanted to do was to give corporations information so that they could understand what is actually happening in the workforce, give them tools and strategies to deal with that, and most importantly, give Black women tools and strategies so they can practice self-care and help mitigate the effects of racism and gender discrimination on their health.
I was going to bring up stress earlier, but since you just brought it up, I find that figure to be so amazing that you just said that we have 15% more cortisol in our bloodstream. And according to your own study, Black women report stress as their top health concern. So for people who may not be familiar with cortisol or the effects of stress, can you tell us why it is that we have more cortisol and why it matters?
So cortisol is a stress hormone, and it raises in our bloodstream in response to stressors. So cortisol is, we sometimes talk about that fight or flight reaction. If your child is in a burning home, cortisol level increases, you can run into the home, you can move a refrigerator, you can move the sofa, you can pick up a car, you can go get your child. You can, that need to rescue and save. That's great. That's when it's really wonderful because it can give you that boost of energy and strength. But when cortisol is chronically elevated, it really takes its toll. It triggers our inflammatory response and our metabolic response. And one of the things I think is really important to know is with greater inflammation comes greater risk for a number of diseases. We've talked about diabetes and heart disease, certain cancers. But the Black Women's Health Study found years ago that this elevated cortisol also changes our metabolic responses. So for example, if you give Black women and white women the same high-fat diet, Black women are going to gain more weight and gain it faster. And if you give us the same low-fat diet, we'll actually lose less weight and lose it more slowly. So much of medicine and public health kind of leads us to believe that this obesity crisis, as they term it, among Black women is because somehow we lack self-control. Well, I would say if any group has self-control, it's Black women. What they fail to realize is that our bodies are responding to these external stressors, and this elevated cortisol, the inflammatory response, and the metabolic changes that it occurs are responsible in large part to how disease gets expressed in Black women. And another brilliant researcher not too far from me at Emory, Tanea Lewis, found that chronic experiences of racial discrimination literally changes the ends of our DNA, these things called telomeres, which are responsible for why our inflammation response changes and why our metabolic changes occur. And so over generations, we see this change so that these cells get frayed and they don't respond as well as they would in people who don't have this situation. And it's something we call the epigenetic expression of stress, because it literally gets handed down from our great-great-grandmothers all the way down. And so this is the time to stop. We need to practice the self-care to mitigate against those stressors, because we don't deserve to be that stressed, and we certainly don't deserve the adverse health outcomes that result from it.
So stress is literally changing us on a cellular level.
It literally
and you
is.
just said this is the time, wow, that we need to stop. I don't want to leave the women out there without some actionable tips and tools now that we've told them how critical it is to manage their stress. How do they do that?
Well, one of the things that I find really exciting about Black women is their entrepreneurial spirit. I mean, Black women are starting businesses at rates much higher than all other women. And so what that means is we also have a level of control that we don't necessarily have in the workplace when we're working for someone else. When I took this role, I said, we always complain about bureaucracy. Well, bureaucracy starts at the top. I'm not a fan of bureaucracy. So as a Black woman entrepreneur, your listeners also can mitigate against the effects of bureaucracy. So imagine Black women-owned businesses, you're not going to have those microaggressions. You're not going to have those constant reminders from other people that you're less than, that what you said isn't as important as what Bruce said, for example. So by being an entrepreneur, you get a level of control over your experience, but also over the experiences of your employees, of your stakeholders, your clients. This entrepreneurial spirit alone is self-care. Being an entrepreneur, as hard work as it is a form of self-care because it gives you control. And it also, as a good friend of mine says, gives you the right to say no. And as we say at the Black Women's Health Imperative, no is a complete sentence. Use it early and often. But for those of us who, can't start our own businesses and perhaps don't have that level of control, we've got to find those things to do. Many of us feel overwhelmed, especially now. We're still in the midst of COVID-19. And what I tell Black women in particular to do is make a list. When we're feeling overwhelmed, make a list of all those things that are overwhelming you. Make a list of all the people you know who can help. Even if you haven't talked to them in a while, make a list. Then draw a line from that thing that's overwhelming you to that person who might be able to help. And then call them, text them, send them an email, ask her for help. And I always ask Black women to reflect on when people ask them for help. And I say, do you ever say no? And of course, we never say no. These women, these men are not going to say no to you either. Ask for help. And I've had so many Black women say, that made all the difference. Just knowing that I had help, knowing I wasn't alone, and knowing there was somebody I could turn to relieve some of this burden. Asking for help, breathing, taking time out for yourself, even if it's just a few minutes a day, can make all the difference. The thing that I really want to make sure that we all know is that there's nothing wrong with us. Whatever you read about our health and wealth and other things in the press, there is nothing wrong with us. And we need to take that into every day, starting at the beginning of the day when we wake up. We need to carry that with us all day long. We are fine. We are wonderful. We are valuable. Elisa, because we did one thing, we woke up.
Wow. That is a powerful statement in and of itself right there. But I love the perspective that you shared on entrepreneurship. As many times as I have talked to Black women about entrepreneurship, and as often as we talk about the importance of entrepreneurship to our own financial independence and to the financial health of our communities, I have never heard it equated with the physical health for ourselves and our communities. So I love that. But there are some truths about being an entrepreneur that I think tend to deprioritize health for women. They don't have an employer to make sure that they have health care coverage. They often have really busy schedules and tend to put themselves last, especially when they're starting out, they're strapped for cash. And then, of course, during the last year and a half of the pandemic, those who operate businesses that put them in touch with the public, like hair salons or restaurants, have been at increased risk of exposure. So what is your advice to entrepreneurs about how they can prioritize their health?
Yeah, I know it's really hard. I mean, I'm not an entrepreneur. I'm obviously leading a nonprofit. But part of the challenge is we have to do it all. I mean, as an entrepreneur, you are the chief cook and bottle washer. But we've got to find that time. As hard as it is, no woman ever regrets having taken some time for herself to just calm down. There's this breathing technique called 5-7-9, where you breathe in for 5 beats, hold for 7, breathe out for 9. You do it 3 or 4 times, takes about a minute, but literally it lowers the amount of cortisol in your bloodstream. Just taking time out to breathe, clear your mind, helps you focus better on your work. For a lot of us, we're so into getting the work done that we sort of miss what is happening around us, and we miss what's happening within us. So as busy as our days are, as busy as our schedules are, as tough as it is to go out and secure funding and hire staff and get that business model working, we will never regret taking time for ourselves. And we just have to. We have got to step away for a few minutes, a few hours, a few days if you can, and really focus on ourselves and practice that self-care, because then that helps us be the kinds of entrepreneurs that we really want to be.
Earlier, you said something that has stuck with me this entire conversation when you were talking about clinical trials and how doctors make a lot of assumptions about what we will and won't do. And it makes me think about the increasing attention that has been given to the fact that Black women are not always listened to in healthcare settings. They don't listen to us when we talk about what we're feeling, our symptoms or our pain. So the last question I want to ask you is how we can best advocate for ourselves in a healthcare setting.
Yeah, this is really tough at times, because some women, first of all, feel like they should be able to trust their physicians, their nurses. And I'm not saying we can't trust them, but we've got to understand that they're bringing their lived experience to our care, and they may not understand ours. But also, we are sort of trained not to question medical professionals. Like, I'm not a physician. Who am I to question what somebody who's trained is saying to me? But the thing that we've got to know is that we have to trust ourselves and trust our guts. We know our bodies. You know, when you were talking about sort of that experience, what comes to mind is what happens too often with pregnant women and people delivering babies and knowing, we've seen too many examples of women who knew something was wrong and their providers didn't listen to them. And then there were disastrous outcomes. Serena Williams almost had one, but she talked about having to get ugly with the staff because she knew what was going on. You know, at that point in your life, that's the last thing you want to do is be ugly. You just had a baby, or you're in labor. It's supposed to be this beautiful experience, but you deserve the best possible care. So I tell a lot of women, whether they're going in for, labor and delivery or whatever their procedure is, know your numbers. And I don't mean, your blood pressure and your A1C level. I mean, know the number of the chief hospitalist, the chief of staff, the chairman of the board, the president of the hospital, the editor of the newspaper. I don't want us to have an adversarial relationship, but sometimes, we have to expect that we won't be listened to. And so we've got to let people know we are paying attention. We know what goes on or what can go on, and we are aware. And bring a friend who also can listen with you and for you. But the real issue here is for the way care is delivered. If I'm pregnant and I'm going into labor and delivery, I'm doing my job. I'm going to have the baby. I have to be able to count on my team to do their job. And so part of what we at the Black Women's Health Imperative are trying to do as well is work with providers, change the way delivery occurs, healthcare delivery occurs. And we say to providers, imagine that woman, that Black woman, is your most favorite relative on the planet. Treat her like you would treat that relative. Whatever care, recommendations, therapeutics, treatments you would advise for your most favorite relative or most favorite person, make that same set of recommendations to that Black woman, your patient, and then things will be fine. Because we know, take breast cancer, for example. If Black women and white women have the same cancer, the same treatment, they will have the same outcomes. So there's nothing about being Black that causes us to have worse outcomes. This is about how care gets delivered. So if we can change that, then we can help eliminate the disparities that just should not exist.
You have given us so much great information today already, Linda. Is there anything else that you want to say to the audience of women listening, to Black women, about their health?
I as I say all the time, trust yourselves. We Black women know what is happening with ourselves. We know what's happening around us. Trust yourselves. Ask for help. You are not alone. And you've got an entire organization fighting for you every single day.
Thank you so much, Linda, for sharing the important work you're doing. Everyone out there, please take a look at their website, bwhi.org, and you can follow them on Facebook or YouTube at Black Women's Health Imperative, or Twitter and Instagram at BLK Women's Health. Check out the podcast channel on blackenterprise.com to find Sisters Inc. and more podcasts from Black Enterprise editors, writers, and experts. Be sure to subscribe to Sisters Inc. on Apple Podcasts, SoundCloud, Spotify, or YouTube. And if you like what you hear, show us some love by leaving a 5-star review or put a sister on and spread the word. This is Elisa Gums with Sisters Inc. for Black Enterprise. Thank you for listening.